nice to meet you. My name is Jessica Parker. I'm a speech-language pathologist and owner of Adult Speech Therapy Services. I've spent my whole career, over 20 years now, working with adults with brain-related communication disorders. It's been my passion to help adults improve their ability to communicate and to maintain their social connections. A big part of that process is educating and training their families, friends, and caregivers about how they can help too. That's why I'm so glad you've decided to take a few minutes to learn more about the role that speech therapists play in the treatment of aphasia. Let's start by talking about why speech therapy works in the first place. The brain's healing process is called neuroplasticity. The brain is amazing and can strengthen damaged pathways and make new pathways or connections to allow information to travel efficiently again. But this process takes time and hard work. That's why people with aphasia need speech therapy, to learn how to exercise their brains to speed up brain healing and to learn how to compensate for communication difficulties. The speech therapy continuum of care is the common treatment path for individuals with acute aphasia, that is, aphasia that happens suddenly, for example, from a stroke or brain injury. Typically, the recovery journey begins with an initial hospital stay, also known as acute care. A speech therapist will likely evaluate the patient's swallowing, speech, and language skills at the bedside. The duration of speech therapy treatment will be brief, and sometimes the patient will be discharged from the hospital before speech therapy treatment has even started. If the person with aphasia is in need of ongoing care from doctors and nurses and rehabilitation, including physical, occupational, and speech therapy, they will likely be discharged from the acute care hospital to an inpatient rehabilitation facility. In this setting, the person with aphasia will typically get therapy every day. When the patient no longer needs to be actively treated by doctors and nurses, usually in a matter of weeks, they will be discharged from the inpatient rehabilitation facility. Some patients will be discharged to their own homes. But if they continue to require physical assistance to complete activities of daily living, like dressing, bathing, and eating, that cannot be provided by family at home, a skilled nursing facility placement may be recommended. After being discharged from the hospital or an inpatient rehabilitation facility to their home, the person with aphasia may qualify for home health care services. This would mean that they have mobility issues in addition to their language disorder and would have difficulty physically getting in and out of the house and traveling to therapy. In this case, the speech therapist would come into the home. Treatment frequency varies, but typically patients receive home health treatment 1 to 3 times per week for several weeks until they are no longer considered homebound. When the person with aphasia no longer qualifies for home health services because their physical mobility has improved, and if they are still in need of therapy, they will progress to the outpatient therapy setting. Outpatient therapy is typically delivered in the speech therapy clinic or can be delivered via video conferencing sessions over the computer, also known as telehealth. In outpatient therapy, the person with aphasia will learn exercises to help heal brain structures, compensatory strategies to improve communication while the brain heals, and learn how to practice between therapy sessions. It's important for caregivers to participate in speech therapy sessions whenever possible. Outpatient therapy can continue for months to years, depending on the severity of aphasia and the amount of progress that is made during treatment. It's important for caregivers to know that once a person with aphasia is discharged from speech therapy services, it doesn't necessarily mean that the aphasia will be gone. Instead, it means that skilled speech therapy services are no longer required in order for the person with aphasia to continue to make progress. Research has shown that the brain can continue to heal indefinitely, And the person with aphasia will learn how to improve their language skills on their own through home practice during their speech therapy treatment, especially with the support of caregivers like you. The Caregiver Coaching Series is designed to provide caregivers with information about aphasia delivered in a way that's easy to understand. Caregivers will also receive many helpful tips that they can start using right away. As a caregiver of a person with aphasia, you can play a very important role in their recovery. To learn more about how caregivers can support individuals with aphasia, check out the other videos in our Caregiver Coaching Aphasia series by going to www.adultspeechtherapyservices.com.